Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Kwara State government trains teachers and some health officials on COVID-19 protocols ahead of school's resumption for exit students. In Plateau State, commercial flights resume at the Yakubu Gowon Airport after 4 months of closure due to the coronavirus pandemic. And according to the World Health Organization, only 6 vaccines are officially on final phase testing, and Russia's is not one of them. The Nigeria Center for Disease Control, NCDC, confirmed 288 new infections last night, a record low compared to the previous daily cases in the past days. According to the center, the new cases were confirmed in 14 states and the Federal Capital Territory, the FCT, with Lagos recording 88 cases, Kwara 33, Osun 27, the FCT 25, and more cases in a few other states across the country. A total of 355 people were discharged in the last 24 hours in 14 states. Edo recorded 92 recoveries, 60 in Enugu, 45 in Kwara, 33 in Oyo, 25 in Ogun, 23 in Osun State. Kaduna recorded 21 recoveries, the FCT 17 as well in Rivers, 12 in Kano, 5 in Bayelsa, 3 in Imo, 1 each in Gombe and Plateau states, putting the total recoveries at 20,663 nationwide. Now, 8 deaths were recorded in 5 states last night, 3 deaths in Edo, 2 in Kwara, 1 each in Katsina, Ogun and Oyo states. Our death toll stands at 896. Taraba State remains the only state in the country without a COVID-19 death as a result of the coronavirus. However, in Nigeria, Taraba State has 43 patients on COVID-19 that are on admission. Till date, the total confirmed cases stand at 44,129, which have been recorded in 36 states, plus the FCT. Lagos, of course, has the highest cases, being the epicenter. The top 3 states with over 1,000 cases on admission are Lagos, the FCT, and Oyo State. For a further look at the coronavirus curve in Nigeria, we have Dr. Ramsey Yama. He's a senior lecturer, Department of Community Medicine, University of Abuja, also a consultant public health physician, epidemiologist with UATH. Thank you for joining us on the program.
Thank you for having me.
I'd like to ask what your take is on the recent trend of the virus curve, which showed 5 days of a regular decrease in the number of positive cases of COVID-19. What would you say is going on?
Thank you. I will say this is good news to the people and government of Nigeria. It may just herald the beginning of the end of the pandemic, but we should not be in a hurry to celebrate. The evidences are not yet very clear. The end of an epidemic is said to have occurred when there is no new case for a duration equal to twice the maximum incubation period of the disease. In this case of coronavirus, we are talking about 28 days. So we are nowhere close to a situation where we have 28 days at a stretch without a new case of COVID-19 in Nigeria. It also suggests that the control efforts of the government and people of Nigeria is succeeding, even though no one prepared for the pandemic anywhere in the world. And Nigerians did their best to do what they could do in a resource-deficient setting such as ours and a very weak health system. It also means that the interaction between the coronavirus agent the human host, and our environment may be working in our favor. And as a Nigerian, I will tell you that Nigerians will tell you that the reason why the curve seems to be flattening is because God has answered our prayers. Thank you very much.
So if we look at some of the figures that we know nationwide, in July saw higher numbers than the numbers in June. I think we had over 17,000 cases alone in July compared to June's 15,000. So some might say that perhaps we peaked around the time of July if the first few days in August we're seeing lower cases, and who knows what is to come at the end of August. So in your estimation, when do you think that we're likely going to peak? And what are your thoughts on some of the states like Lagos that say that August will be the likely month that they would peak?
Coronavirus is propagated direct person-to-person pandemic. It is very difficult to predict when it will go down and when it will rise. As we have seen in the case of June and July this year, we had something that looked low only for it to shoot up again. So it is indeed very difficult to say whether this trend or downward trend will continue. Therefore, Nigerians must not let down their guard. The control efforts must continue, and we hope that the viral agent, the human host, as well as the environmental factors that have been working in our favor in Nigeria and indeed Africa will continue to do so. In the case of Lagos, I will say that it's good news to see that the trend also is reducing in Lagos State, which has been the epicenter of the pandemic. But again, we must not be complacent about the control efforts, as any complacency is going to take us back to where we started. And I'm sure we don't want to see ourselves in that position.
We'd like to thank you. We appreciate your time on the program. Dr. Ramsey Yama, Senior Lecturer, Department of Community Medicine, University of Abuja. Thank you for joining us on the program.
Thank you for having me.
Now, students who are preparing to write their final exams and those in exit classes are resuming this week across the country after they were forced to close in March due to the coronavirus pandemic. Channels Television monitor different states and the measures in place to make sure the schools are safe for all the stakeholders. Schools across the country are reporting some degree of preparations and readiness for the return of exiting students to write their WAEC examinations. This is after the Presidential Task Force on COVID-19 gave the go-ahead, albeit with caution.
We informed you about the date that exit examination classes in schools would reopen.
The reopening is expectedly to be guided by the best interest of learners and the overall public health considerations. In Ogun State, the senior secondary school 3 students are happy to be back. A visit to some schools in the state show the safety measures in place.
Since we are back in school, we are expected to observe social distancing rules. We must always wear our face masks.
We want to thank the state government for providing face masks for every student. And this face mask was given to every student throughout the whole state. So they put on their face mask. We also have social distancing. The sanitization is there. The forehead thermometer is there to take their temperature as they come in, and the hand washing materials are there.
The arrangements in Delta State entail that only 20 students are in a class. Each student is expected to fill a medical form to help identify those with underlying illnesses. The schools are to be provided with water storage tanks, liquid soaps, sanitizers, free face masks to students and teachers.
We have provided sanitizers in all the schools. As you come in, you're expected to take your temperature at the gate. And we have in all the schools, we have trained about 5,867 personnel. And they've equally come back to school to train the other teachers and other workers in the schools.
Students at the Model Secondary School in Asaba, the state capital, go through the various protocols at the gate before they are allowed into their classes. The usual assembly protocol is cancelled and learning takes off immediately.
We are working according to the guidelines because in each of the classes we have 20 students, 20 at most.
Over in Uyo, the Akwa Ibom state capital, it's an orientation program facilitated by a private school. They appear ready for safe reopening. However, for this public school in Uyo, overgrown with weeds, nothing is certain yet. According to the Minister of State for Education, an assessment tour will monitor compliance and level of preparations for reopening across the state, while for other categories of students, it's business as usual for now, learning under the coronavirus pandemic. Staying with school resumption in Bayelsa State, the state government has provided about 10,000 face masks, scanners, other hygiene-related materials for all secondary schools across the state. The governor, Doye Diri, has also inaugurated a monitoring committee charged with the responsibility of ensuring full compliance to the COVID-19 protocols to be adopted by all schools.
We must continue to keep the protocols and guidelines to avoid any further spread of COVID-19. And that is why we are gathered here today, as we are prepared to reopen our schools. We are here to train key stakeholders in the school system and in the health sector, who will then extend same to their colleagues when they go back. Let me also caution those private schools that are not registered with the Ministry of Education. This administration will not tolerate any school that is not meeting up and keeping up to the standards, policies of this government. Therefore, such private schools will find themselves no place in this administration.
It's a new normal for air travelers due to the risks associated with the spread of COVID-19. At the Yakubu Gowon Airport, Jos Plateau State, commercial flights resumed after months of inactivity due to the lockdown. It shows the new measures in place in compliance with directives and guidelines for the resumption of activities at the airport.
The Yakubu Gowon Airport in Jos, the Plateau State capital, is back to life with the resumption of activities after a ban on flights across the country took effect in March due to the COVID-19 pandemic. In adherence to the safety directives and guidelines of the Presidential Task Force on COVID-19, the airport managers have put in place the necessary equipment needed for staff and passenger safety, with the provision of disinfectants for luggage, hand wash points, hand sanitizers, as well as maintenance of specified physical distancing at the departure and arrival points. It's been a long wait for passengers eager to get on the plane as they braved the unfriendly weather in the early hours of the day. And in line with the new developments, they go through the drills of being sprayed with disinfectant, temperature checks, and washing of hands before admittance to the terminal area where they wait eagerly for their flight.
Before we actually start, we have put many things in place for the safety of the passengers. You can see we have washing basin there. We have, on the inside, we have taps. We don't need soap all over. Actually plead with the passenger to please use all these things.
And when the plane eventually landed, it was a reflection of how passengers had been longing for the trip, with 86 passengers arriving from Lagos, while 50 boarded for the return trip. A big relief for many.
At first, I was a bit skeptical, but with what I have seen on ground, I think it's safe. Our lives are coming back to normal, and it's wonderful. It's wonderful.
At the airports, the arrangements, the protocols have been very, very okay. But I was surprised that when we entered the flight, there was no physical distance in the flight. No space was left. All the spaces are filled up. It was unlike what you saw at the airports.
The gradual resumption of flights in airports across the country means passenger activity will no longer be the same, with the COVID-19 protocols now a permanent feature in addition to the usual security checks.
Still to come on the program, we'll look at testing when we return. Please stay with us. Welcome back. The Deputy Governor of Kwara State, Kayode Alabi, and his wife, Abeyowa Alabi, have tested positive for COVID-19. Their positive status was confirmed after undergoing the coronavirus test following slight symptoms of the virus. The couple say they are in high spirits and are now undergoing standard management protocols supervised by the government's medical team. Immediate contact tracing and tests, among other safety protocols, are being done for persons who may have met with them in the past few days. For more on testing, in light with the reduced, or rather the downward trend of coronavirus cases in Nigeria, we have Dr. Clementina Anowai, Deputy Director, Head, Medical Laboratory Services, the FCT, Primary Healthcare Board. Thank you for joining us. She joins us from Abuja Studios.
Thank you for having me.
I'd like to start with the reports we're seeing from the NCDC. It shows that our testing has also been at its lowest in the last couple of days. This perhaps were things we saw when our cases were not this much, over 40 in terms of confirmed cases. But looking at the outbreak, shouldn't we be scaling up our testing, seeing as we now have more labs, over 61?
Actually, why we had the reduction in testing over the weekend was due to the Salah break. So during the break, people traveled, some people stayed back, and there weren't much activity. So that was actually why we had that reduction. And just as we are coming to the new week, people are just coming back. So we actually need to do more advocacy, because with the opening up of markets and schools, some still believe that we are containing coronavirus, is no longer there. So do more advocacy with the centers we have for people to come out to be tested. Actually, we have more collection centers. We also have more testing centers. Even there's need also to have testing centers in most of our hospitals, so that people will also go there to have services done. We also need to create collection centers, even at the market. Now in the market, we need to run their usual market days and market time here in FCT. We also need to have a sample collection, even at schools. Currently, some schools have been calling on public health departments here in FCT to get their staff and students to be tested, so that we have that baseline. So I believe that with the new week and with activity picking up, the testing will increase. More people will avail themselves of the opportunity to be tested.
Do you think that that would also mean more cases?
Yes. If you look at the more we test, the more case we have. So we need actually to increase our testing capacity. We need to have a sample collection even at marketplaces. We also need to have sample collection at these schools, both private and public schools, because the more we test, that's the only time we'll know the number of positive cases. You can see that with the report we had over the weekend, that the number tested reduced. With that, the number positive also reduced. So there is the need for us to do more advocacy for people to avail themselves of the opportunities available for them, especially now government is having these services free. Here in FCT, we have over 12 sample collection centers, and we have over 6 sample testing centers. So there is a need to do advocacy. We could move in to schools, markets, collect samples, and get them tested. It's when we test a good number of our people that we'll be able to know the number that are positive, and in that case, we'll be able to know whether we are containing the virus or whether the virus is on the increase. So what I'm saying is we need to do more testing, more advocacy. People should avail themselves of the opportunity available to get tested and also receive services available here in Nigeria.
All right, we'd like to appreciate your thoughts. Thank you so much for joining us on the program. Dr. Clementina Anowai, Deputy Director, Head of Medical Laboratory Services, the FCT. Thank you for joining us on the program.
Thank you for having me.
Now, in the race to create vaccines across the world, about 140 are in early development and around 24 are now being tested on people in clinical trials, including the Russian vaccine. However, 6 potential vaccines have reached the 3rd stage, one developed by the University of Oxford. Russia is planning to go ahead with mass vaccinations in October, something the World Health Organization has raised concerns about. Here's more on the global update.
The assessment by the World Health Organization's Special Envoy on COVID-19, David Nabarro, comes as more than 18 million people around the world have contracted the virus. Nabarro stresses the importance of being able to trace, test, and isolate people, saying that if that is done, then surges are kept really small. Latin America has over 5 million cases of COVID-19, making it the world's hardest hit region, with Brazil continuing to drive the regional surge with more than 2.7 million infections and close to half of the region's more than 200,000 deaths. Colombia, another hotspot, recorded 11,000 new cases in the last 24 hours, and other nations, including Mexico, Peru, and Chile, are struggling to contain the pandemic. In the U.S. state of California, the U.S. Department of Defense has deployed nearly 200 medics and logistics experts across the state over the past 2 weeks to reinforce hospitals and provide much-needed reprieve to healthcare workers.
Our providers have integrated into the 8 supported hospitals as a member of their staff and as a member of their team. So we are not, working on isolated wards. It's not like we have any Air Force tents that are set up outside. We are truly jumping into the staff in each of these hospitals to help support in any way, shape, or form that we can.
Finally, the Hong Kong government has announced that COVID-19 prevention measures in the region will be extended for another 7 days until August 11th. The new round of measures were introduced on July 29th and include compulsory mask wearing in all public places, limiting group gatherings to 2 people, and closure of entertainment venues, and tightening testing and quarantine arrangements.
For more updates, take a look at our website, channelstv.com. It has the latest updates on the pandemic. That's channelstv.com.